Paylocity presents Healthcare Reform Beyond the Hype. In this series, we're taking a look at the shared responsibility provisions of the Affordable Care Act, also known as Player Pay. Now, these provisions go into effect in benefit plan years beginning on or after January 1st of 2014. Now, shared responsibility requires that large employers offer an affordable health plan providing minimum value to 95% of all full-time employees or face a penalty. In this video, we'll work to understand affordability and minimum value. First, let's take a look at the consequences of affordability and value on the penalty calculations. For employers that do offer coverage, but if that coverage is not affordable or doesn't provide minimum value, the associated penalty is $250 per month, and that's $3,000 per year annualized, for each full-time employee that receives a subsidy for coverage at a public exchange. Now, it's important to note for that penalty that if an employer does offer an affordable plan of minimum value, but the employee chooses to purchase exchange coverage anyway, that there's no penalty to the employer. It's also important to note that the penalty owed in cases when an employer does offer coverage can never be greater than the penalty owed for an employer that does not offer coverage. So let's talk a little bit about affordability according to the Affordable Care Act. Now, you can imagine the conversation in defining this portion is going something like this, where legislators define a health plan as being affordable if the cost of single coverage in that plan does not exceed 9.5% of an employee's household income. Now, the natural response from an employer, based off their payroll information, is that I really don't know what household income is. I only know what I pay the employee. You can have an employee that makes a minimum wage married to someone who pulls down six figures, in which case they would not be eligible. And the flip side is you might have a C-level officer whose spouse runs a business at a loss, in which case they may actually be eligible for subsidized exchange coverage. Knowing that, there were a number of safe harbor provisions that have been released to allow an employer to more easily comply with the affordability provision. So long as the employer can demonstrate good faith in complying with those safe harbors, they would not face a penalty with regards to affordability. Now, affordability in the Affordable Care Act is specifically defined as meaning that single coverage in the employer's least expensive plan that provides a minimum value does not exceed 9.5% of quote-unquote income. Now, there are multiple safe harbor methods that define what income is. So that income can be the employee's W-2 wages, and that's defined by the wages in box 1. Those wages could be the federal poverty level for a single individual, and those wages could be the employee's monthly full-time equivalent wages. So for an hourly employee, that'll be their hourly rate multiplied by 130 to arrive at their full-time equivalent wages. It's important to note that an employer could choose to use different affordability safe harbor methods for different groups of employees, so far as they do so uniformly and consistently for our employees in that category. There are a number of special considerations for each method. If employers choose to use the Box 1 W-2 safe harbor method for all or some of their employees, it's important to note that we realize that Box 1 wages are not the same as gross wages. Box 1 wages are reduced by 401k, traditional 401k, and Section 125 contributions. For employees who are not employed or eligible for coverage for the entire year, their W-2 is prorated for the portion of the year that they were eligible for coverage. So if a new hire is eligible 5 months out of 12 months in the year, their W-2 wages would be prorated by 5/12 for the purpose of the affordability test. For employers that choose to use an hourly rate safe harbor method, the rate in question is that rate that was in effect on the first day of that plan year. Employers using this method cannot reduce the rate of pay over the course of the year. It's also important to know that for employers that are interested in using the federal poverty level safe harbor for all or some of their employees, that this safe harbor is consistent across the mainland United States, but is different and higher in Alaska and Hawaii. There are, of course, a number of practical considerations when discussing which safe harbor is most advantageous for an employer. In general, an employer should analyze their employee population to determine which safe harbor method returns the largest dollar amount per employee. And again, that may depend on how employees are compensated, hours worked, etc. The next concept in the Affordable Care Act we'll talk about is the concept of minimum value. Now, under the Affordable Care Act, a plan is considered of being minimum value if it covers at least 60% of the total allowed cost of benefits provided, and that includes accounting for co-pays and deductibles. Now, the Department of Health and Human Services has actually released a calculator online to assist employers and brokers in determining the minimum plan value of a plan design. That's an Excel spreadsheet that looks something like this and is asking for specific inputs that will then return the plan value itself. Be sure to visit the Healthcare Reform page on Paylocity.com for additional videos and resources in navigating the Affordable Care Act.